We're good to go. Right here. So good morning, everybody. Welcome to the Stop the Bleed presentation and to everyone out there zooming in. This is the first time I'm zooming this, so a little bit different for everybody. I'm sorry for the slight delay this morning, but as I've learned this week, and you'll find out in a few minutes, plans can change at a moment's notice. So my name is Becky Sears. I'm the Injury Prevention Coordinator for Bassett Medical Center, and I come out and teach the National Stop the Bleed program to businesses, schools, and anywhere in the community. And the reason why we started this program, well, I didn't start it, but it was started in 2012 based on some events that happened down in Sandy Hook. So y'all know what that is when we talk about it, right? It was a shooting down at that elementary school. And what they found when they went and did autopsies and stuff on those kiddos is a lot of them bled to death. That was their cause of death. So the White House and the Department of Homeland Security with some physicians and lay people out in the healthcare field got together and said, we can prevent some of these deaths if we can get people trained in how to recognize and some skills to stop a life-threatening bleed. So they did that. They came up with this Hartford consensus and developed this program. And our goal is to get it out into the community and teach as many people as we can how to stop a life-threatening bleed the same way we would do CPR. For all of our high school seniors have to have that before graduating now nationwide. So we're out there trying to get this program, again, to as many people as possible. I use an older version of the program, and I just kind of warn you on that. There are some graphic images, so if anyone just had breakfast this morning, they're there. I don't put them there to gross anybody out or make anyone uncomfortable. I leave those images in because I want you to see what a life-threatening bleed looks like on the screen. It gives your brain time to, process it, put it in the back. And then if you, God forbid, ever see it in real life, it's going to be not so much of a shock to you. You can say, oh yeah, I saw that before. And you can jump right in and try to help those people. I try to let you know when those images are coming up, but sometimes I forget. And you just have to go along. The slides you're going to see in front of you, if anyone really wants to read PowerPoint presentations, if you really like that kind of thing, I'll get you a copy of them. You'll notice I am going to flip through some of them. The slides are there just to kind of keep me on track as we go through. All right. So let's just jump into it. Why do you need the training? I'm going to preempt it with something that I normally don't say at my trainings, and I really wish I didn't have to. Part of the reason why I was late here today is Sunday night at 4:30, I lost 2 family members to a motorcycle accident. Gramps was 70 and Tracy was 45. Tracy bled to death on the scene because bystanders didn't know how to stop him. They started CPR, but they didn't know how to stop her bleeding. So this makes it a little bit more passionate for me today, giving you this training. I don't know how many people are listening in, but probably over 100, right? So by the end of this day, we're going to have 100 more people trained to know how to stop the bleed. So when we look at it, mass shootings, bombings, certainly we see that. Started with Sandy Hook, Columbine, Las Vegas, the Pulse nightclub down in Orlando, some of the big ones that come to mind. The Pulse nightclub in Orlando, there were 49 victims in that incident, and 16 of them bled to death when autopsies came back. So 35% of pre-hospital deaths can be attributed to life-threatening bleeds that resulted in the person dying. So if we can stop the bleeding quicker, we can save these people's lives. So sure, mass bombings and shootings, we're in rural upstate New York, and if we think that we're immune to things like that, it's like I said, what, Vegas, Orlando, you think of big cities, things like that. It can happen here. We have to be prepared for that. Next week we have the Hall of Fame induction ceremonies in Cooperstown. We have a lot of people coming into town. That's an induction ceremony in a big open field, and someone with a bad thought and the means to do it could cause a lot of havoc for us. And we're prepared for that at the hospital, and with these trainings, we're getting more people prepared to handle those type of situations. But just think about home injuries. I have a dairy farm at home. There's a lot of things that I could get into on the farm that could cause me a life-threatening bleed. And even just the kids that, having a glass of milk at night and leaving that milk, not rinsing that glass out, and they put it on the counter, and you come along in the morning, you're gonna wash dishes up, and what do? We take the cloth, take the glass, we stick our hand down into it. Many times the glass is broken on me when I've been doing that. And if I was a person that was on blood thinners, that could be a life-threatening bleed for me, depending on how badly I was cut. Lawnmowers, hedge trimmers, things like that. Just falling off the ladder, doing something, getting yourself cut could be a life-threatening bleed. You can just start thinking of all the different ways that you could get hurt. What about work-related injuries? The BOCES Center, you do a lot of skills. We have the auto shops, we have the building trades, we have the cosmetology, we have the culinary. Lots of opportunities there for kids to get hurt. And, you think back, an incident that, happened within the last 2 years to one of your students, could have ended up differently if some skills weren't used right away to help that student out. And again, on the bottom left, motor vehicle crashes. You never know whether you're involved in one or you're just driving down the road, you happen to come around and you see one, you might be that first person there that's going to help somebody out. So that's why this training is really important as we go through. Kind of the ABCs of this program. You're going to find the life-threatening bleed, you identify it, you find it, and you fix it. It's not going to be rocket science. By the time we get done with a couple of the skills here, you're going to be like, oh, that was pretty easy. I could do that. And it really is. It's simple. Even if it's an arterial life, we're pumping blood out of somebody. Just a couple of steps, we can stop that and we can save that blood and save that person's life. But before you go and do anything, I'm an EMT for Middlefield Volunteer Fire Department. And when I took my classes, the first thing they teach you is you cannot become the second victim. In order for you to help somebody, you've got to keep yourself safe. So it's kind of like that 3-second look before you jump in. Just take those 3 seconds and say, there we go. I'm like back in school again. There is that opportunity to say, am I safe approaching this person? Even if they're bleeding to death, am I safe going to approach them? If it's a motor vehicle accident, are there wires involved in the vehicle? Then you can't approach it. My daughter and I came around the corner one day and there was a Jeep on the side of the road in the ditch on its side. And I told her, I said, hey, Shannon, call 911, and call us in. And she laughed and she's like, they're going to page you out. I said, yeah, I know, but I need some help because the Jeep is on its side. Is it safe for me to approach it? The woman was trapped inside. Luckily, she wasn't injured, but was it safe for me to approach? Because I try to get her out of this Jeep and the door's up here now. I've got to get the door open, try to get her out. That Jeep come over on me because it wasn't stabilized. So you kind of have to take a step back for just a minute and say, am I safe? If it's at somebody's house and you go to try to help somebody, do they have a pet, a dog or somebody that's going to think that you're hurting them rather than helping them? You may have to kind of secure those areas first. The other thing we talk about safety with Stop the Bleed is we're dealing with blood. And there's a lot of pathogens that can be hiding in blood. So you want to make yourself safe. Gloves are a good thing. I have them when I do training. So when I come out to the different locations to do the skills portion of this training for you, I'm going to have lots of gloves so you can get them from me. I suggest that you take a couple extra pair, throw them in a bag, throw them in the console of your car, glove compartment, bottom of your backpack, purse, whatever you have, so that you always have them close by should you ever need them. And I always joke, if you don't want to take them from me because you're feeling weird about it or whatever, the next time you go to the doctor's office and the nurse or the doctor steps out for a minute, you just walk over to the wall where they have all the different sizes, take some gloves, stuff them in your pockets. They won't mind really, and then you'll have them. But really important to have yourself a barrier when you're dealing with somebody else's blood if you can. If you don't have gloves, find something. You got a jacket, you got a piece of plastic, whatever. Try to use that as a barrier for yourself to protect you from getting their blood on your hands. I've worked on people in EMS without gloves on before and gotten people's blood on my hands. It's a choice that you decide to make, okay? So the first thing you want to do, of course, call 911 if you can. Someone's got to bleed. We're going to call 911. We're going to get EMS coming. Even as an EMS provider myself, I want extra help coming. And you know, some of the areas we have really good cell service. Everywhere you go, these back roads, we got great cell service everywhere, right? So what do you do if you don't have cell service? You got to either take that person with you or try to do what you can and then go get help. But if you have cell service, call 911. It's going to take us a little while to get there. If somebody had a life-threatening bleed, you guys know about how long it would take for them to bleed out? Any thoughts? 3 minutes. Yeah, real close. 2 to 3 minutes, depending on what type of bleed it is. So as an EMS provider, and I also have a dairy farm, like I said, so I'm usually busy, you know, working and doing things. If I get toned out for a call in my area, in my neighborhood, I can't leave my cows hanging. I got to hang the machines up, shut things down, get in my car, drive to the station, get in the truck, call dispatch, tell them I'm en route and get to your location. How long do you think that's going to take in the rural settings that we live in? 15, 20 minutes probably at best. 2 to 3 minutes, you can bleed out with a life-threatening bleed. 15 to 20 minutes before professional help is going to arrive. We've got to do something about that time. So I am a first responder, but by the time you guys all get done this training, you're all going to be immediate responders. So you're going to be, you may be the person down the road standing next to or 50 feet away that's going to start these skills to stop that person's bleeding before EMS can get there. And that time is what's going to help save that person's life. But we need to know what a life-threatening bleed looks like. Now, to a small child that skins their knee out on the playground and they have some capillary bleeding and a little trickle going down their leg, that's a life-threatening bleed to them. Or you all know, you probably have children and they came running in with a little, you know, drop of blood on their finger and they're kind of freaking out about it because they're bleeding. They know it's not supposed to be on the outside. That's not what we're talking about. When we're talking about life-threatening bleeding, a couple things to look for. If you see blood gushing or spurting from a wound, that's a life-threatening bleed. That's an arterial bleed. Every time the left ventricle is contracting and it's pushing that blood out. It's a closed system. We have our heart, you know, the pump, and our veins and arteries are the pipes. And like with a water line or something like that, you get a hole in it and you see that the water's just spraying everywhere. Kind of the same thing with our system. If you see blood that's spurting, spraying, anything out of a wound like that, we've got to take care of that. We've got seconds, right? And that's something we're going to work on pretty quickly to control. I don't know if you can see the model up here, but there's kind of fake blood pooled underneath it. If you see someone bleeding and that blood is starting to pool underneath them, that's a life-threatening bleed. We've got to take care of that pretty quickly. If our first response when someone is bleeding is like, okay, we're going to put some cloth over it, you know, and try to soak up some of that blood. If the blood is soaking through what you're putting on and you go and put more on and it's just soaking through everything, it's soaking through their clothing, that's a life-threatening bleed. And we're going to take care of that quickly as well. The other two that you might be seeing on the slide is one, it says a loss or part of loss of a limb. Sometimes with the amputations, full or partial, they can bleed quite a bit, and then sometimes they don't. It depends on how that extremity is severed, but we'll consider that a life-threatening bleed as well. We'll treat it as such. And the last one, you might say, well, you know, it says change in a level of consciousness or becoming confused. Well, how does that a life-threatening bleed? I don't see any blood anywhere. In that case, we're talking about internal bleeding. It's not something that you're going to see. But if someone, say, took a bad fall off of a ladder or some other means, and you're talking to them, maybe they've got a few just scrapes and cuts, and you're like, all right, well, this doesn't look too bad to me. And they're telling me what happened, and then all of a sudden, they start talking about pink flamingos, you're going to be like, what's going on here with you? They could very well have an internal bleed that's changing their level of consciousness. That's not something we can take care of pre-hospital, but it's just something to be aware of what some of these symptoms of life-threatening bleed might be. I believe the next slide is going to be where we start some of the photos. So there's just my little warning to you there. On the one side, you see the blood is pumping. That's an arterial bleed. pumping, spurting out from that wound. That's actually a hog when people were hurt. And actually that animal was not hurt in the process either. They have ways that they can attach pumps and kind of make it a little more realistic for us. The other photo there, that's a lower leg injury, certainly a severe injury with the tibia there. You don't see any active bleeding from that site, but you see where it's pooling underneath, soaking through all of that gauze and stuff. So that would have been a life-threatening bleed for this person. And I'm sure if we could enlarge that picture up, you're going to see a tourniquet is probably placed above the knee on that person there. But this is some of the things that you might see that's going to indicate to you it's a life-threatening. About 5 or 6 times during this presentation, you're going to hear me say, if it is a life-threatening bleed, a severe bleed to an arm or a leg, and you have a tourniquet available to you, I want you to use it right away. Don't hesitate in getting a tourniquet on. Years ago, it used to be like, oh, I can't put a tourniquet on them because they're going to lose their arm or lose their leg if I do that. And that's not the case. As long as that limb could be saved in the first place, putting the tourniquet on is not going to change that outcome for them. It's better to risk the arm or the hand or the leg than to risk that person's life. I can live without one of my extremities, but I can't live without the blood pumping through my body. Right? We need to keep that in. We only have a certain volume of blood. The average person is 4 to 6 liters of blood. So if you think about 3 2-liter soda bottles up here, if I take one away, we'll probably be okay. Not feeling the greatest, but we can probably live through that. But there comes a time where we suffer a certain amount of blood loss that puts us into something called hypovolemic shock. And that's what ultimately kills us. We have that certain volume of blood and that we can afford to lose. And my volume of blood is going to be different than yours or yours because we have different bodies, sizes and everything. And like our credit score, I know what my credit score number is. I'm pretty good. I've been working at it. But I don't carry a card that says, hey, Rebecca can afford to lose 350 milliliters of blood before she's going to get into trouble with blood loss. We don't know what those numbers are. So we have to contain all the blood that we can. So an arm or a leg injury, tourniquet available, they're severely bleeding, don't hesitate to put it on. And that doesn't mean you're going to bleed. Hey, you just hang out. I know the tourniquet's down in the main office. I'm going to get that and come back. You provide something, get somebody starting to stop this flow of blood. We're going to show you how to do that, but then get the tourniquet and apply it. Most preventable death from injury, if it's an arm or a leg and we have a tourniquet, if they're bleeding, we'll stop that flow of blood within 30 seconds. It's that quick. It gets a little bit harder when it's a junctional wound. If it's the neck, the shoulder, the groin area, really can't put a tourniquet on those areas, right? It doesn't work. It's not like an arm or a leg. So if it's a wound to one of those locations, we're going to pack that wound. We're going to show you how to do that. And then we're going to apply pressure to it in a certain way to get that bleeding to slow down, if not stop. So junctional wounds get a little bit more difficult. And even escalating that, if it's a chest or an abdominal wound, say through gunshot, I like to think of like buckshot, where you have a lot of openings, a lot of wounds in that area. Well, what are you going to do? You can't put a tourniquet on it. Some of them are hard to pack. We could try putting some packing material in it and putting some light pressure on it. But for folks that have chest and abdominal injuries, we do the best that we can. We'll put some packing, like I said, some light pressure, and then we let EMS know as soon as they get on scene that we have a person with this type of injury. They're going to be getting to the hospital, to the OR, to definitive care. Because that's internal injury, internal bleeding. There's nothing we can do, like I said, pre-hospital to stop that. We can slow it down maybe a little bit on the outside, but internal, we've got to get to the OR. So cannot be stopped outside the hospital. So what do? We've ensured our own safety. We have our gloves, we have some sort of a barrier. We've checked that scene out. It's safe for us to approach that person for help. We look for that life-threatening bleed. Now, if they have clothing on, you may have to expose that area to see it. It doesn't mean get them trauma naked on the side of the road or down in the hallway, but a pants leg, shirt or whatever, open up that area so you can see that wound. And we want to do that for a couple of reasons. If we're going to pack this wound with some gauze or cloth, I'm going to be sticking my fingers inside of this person. What if they were cut on glass? We might not have any visible that I see on the outside, but there could be shards of glass inside the wound, and I don't want to stick my fingers there, get myself cut, nor do I want to push that glass further down and transect something more. So we just want to take a look. If there's dirt, grass clods, sticks, something like that that's just in there that they got cut on, you can scoop that out of the way. If there's pooled blood, you can kind of scoop that out of the way. Just be careful not to dislodge any clotting that may have happened, because it takes 6 to 7 minutes for a clot to really start to form, and a lot longer if somebody is on blood thinners, Coumadin or Eliquis or something like that. So we don't want to do anything to disrupt that clotting process. That's what we want to happen. But you can kind of look and scoop that out of the way. So if I looked on this person's leg and I can see they have a pretty good bleed, I can see the vessel, I can see the blood coming right out of it. If I have my gloves on, I'm going to take my finger and I'm going to press right down on that vein or artery, and I'm going to pinch it off and stop that flow of blood. You just kind of want to, take a look first, not because, you have a warped sense and you want to look at these injuries, but you got to see what you're doing before you can really fix it. Take any clean cloth that you can find. You see right where that artery is, vein is, pinch it down on it. And you'll see this more when we do the hands-on skills for you folks. It might be kind of hard to see here, but you're just going to go at kind of a back and forth fold. And you just keep stuffing it into the wound, and you just keep filling it up until you've got it pretty full. You don't want to overstuff it. You don't want to make the wound bigger than it was to begin with, but just back and forth, filling it in. This is a pretty big laceration on this model's leg, so it takes quite a bit. So we've got it stuffed all the way in there. Then we take something else, some cloth, put it on top, and we're going to apply some pressure. So this is going to tell you if you did not have a trauma first aid kit available, you didn't have a tourniquet or anything, you're going to use any clean cloth that you can find. And I say clean in quotes because, let's say if something happened in my dairy barn, there's nothing clean in my dairy barn. It's cobwebbed, it's organic matter, it's hanging on the wall for the last 2 months. But if I needed to use it, I'm going to use it. And chances are the person that you're trying to help has some item of clothing on that you can use, you can cut off to use, or something that you have on that you can use. Or it's perfectly acceptable for me to say, sir, can I have your shirt? And I'm going to ask you to give me your shirt, and I'm going to use your shirt to stuff down into the wound. So we fill it up, we take the clean cloth, whatever you can find, put it over it. 2 hands, almost like you would do CPR, right on top, and you're going to press down. You're going to press down pretty firmly. You need to have that person, that limb, on a hard surface. If they're on a couch, a bed, a school bus seat, something like that, get them onto a hard surface because you want that resistance of that surface pushing back. So you can think about it. It's like your hand on the cloth, your cloth onto their skin, pressing down onto that vein or artery, and then you've got to compress it against a bone to actually get the bleeding to stop. And that may take a lot of pressure. It's not just holding this lightly, it's locking your elbows up and it's pressing down hard to get that to stop. This is one of the only videos that photos that they left in the new program. All the kids have a brand new white shirt when they're out playing on the playground, right? All they're showing you here is his friend got hurt. She's got a pretty severe bleed. He doesn't have a tourniquet right there with him, but what he can do is take off an item of clothing that he has on, and he can use it to treat her injury until help arrives. If you do have a tourniquet available to you, like I said, an arm or a leg tourniquet is available, please use it. They're designed to stop the flow of blood in a very short period of time. This model here is showing a tourniquet in place. These are very simple devices. This is called a combat application tourniquet. It's designed by our military. All of our men and women in service carry them. Our police officers, a lot of firemen carry these, right on their uniforms. It's a simple Velcro strap. This little bar here is called a windlass, and it has some high-grade aircraft aluminum inside, makes it very strong, and it has a lock-in clip. We good?
Those are the, you don't read the video.
Oh, okay.
Sorry.
That's all right. It has a locking clip. They're designed to be able to put on one-handed if you need to. Again, our men and women in military, they use these out in the fields. For a tourniquet application, they tell you to put it 2 to 3 inches above the site of active bleeding. So if I had a laceration down on my lower arm, I would have room to come in and apply the tourniquet in this area here. If my laceration was a little bit higher, 2 to 3 inches is going to put me right on my elbow joint, and I can't use the elbow joint as a place for tourniquet application. Same thing with the knee joint. Just the structure of the joint will not allow us to compress down enough to occlude that vessel and stop the flow of blood. So we've got to come up somewhere, stay away from the joints. Now, in a real life situation, your level of anxiety is going to be high. You're going to be worried about, are you doing this right? I don't want you to have to be, oh, did she say 1 to 2 inches, 2 to 3 inches? I don't remember. It was professional development day. I really wasn't paying attention. Just kidding. If nothing else, remember to come up high and tight. If it's an arm injury laceration, you can come up to the top of your arm and catch the brachial artery. If it's a leg, you can come up to the top of the thigh and catch the femoral artery. It's going to stop the flow of blood to that limb. And then you don't have to remember with 2 to 3 inches, or what. You just want to leave yourself enough room. If I place this up on the top of my arm, I'm going to leave a little bit of room, because if for some reason I cannot get the bleeding to stop with one tourniquet, which I should be able to do, but just, there's always those outside parameters. I can place a second tourniquet if I have one available above the one that I just put on. So let's just say I have a laceration here. I'm going to come up and I'm just going to snug the tourniquet up. And again, when we do your skills sessions, you'll get to play with these and you'll see it a little bit better. I've exposed the area. I can see where the bleeding's going. I then take the windlass and I'm going to turn the windlass and watch the bleeding. And I'm going to turn the windlass until the bleeding stops. That may be 1 turn, that may be 8 turns. It depends on the injury. Once you've got the bleeding controlled and stopped, these will lock in on these tourniquets into place. So it kind of gives you your hands free a little bit. You've got all this extra here. And what I like to do is tuck it under the clip just to get it out of the way. It's Velcro. So if you had a sweater on and it attracted the Velcro and you go to move to grab something else to help this person, you may accidentally pull it. Or if they're not happy that you put a tourniquet on them and you just left it like this, they could pull it and loosen it up and start the bleeding again. So I just like to tuck it underneath. So you tighten your windlass up till the bleeding stops, just tuck that underneath. And on the practice tourniquets that you're going to be using, this little Velcro is attached to it. Mine here is not. You just put it over the top and that's it. Tourniquet's in place, pretty easy, right? The last step we want to do with this though is we want to record the time that we applied the tourniquet. Ideally, we'd like to have it off within 2 hours from the time of application. So if it's 10 minutes to 9 now, by 10 minutes to 11 in the emergency room, I'd like to have that tourniquet off. Sometimes when we're on scene and we have an application from a motor vehicle accident, it might take us a little while to get that person out of the vehicle. So it's important for us to know what time we put that tourniquet on. So on the tourniquets that you can usually purchase or that you'll see, it'll be white here and it says time right on it. So you can just take and write the time on it. I had someone ask me just the other day and they're like, well, I don't have a pen. I don't have, a marker. I don't have anything. The pencil's not really going to write, especially on this one. It's black. You're not going to see it. What could you do? We need to record the time. And someone said, well, I could put it on my phone. So yeah, we all have our cell phones. We could just kind of make ourselves a little note, let EMS know. You can also take a little bit of their blood and you can write it with the blood. Or you can take it and put a T on their forehead and put the time on their forehead if you couldn't write it on here. It's one of the things they teach us in EMS, so I share that with you. It's perfectly acceptable to do that, and it does work. So in a bind, you don't have something to write with. Don't be afraid to go ahead and do that. I know you've changed me over, so I won't have my slides, but that's okay.
I can move you back.
I can go on without it.
Okay.
It's fine. It's fine. So that's going to be our tourniquet application. There are many different brands out on the market. I do not work for CAT, for the Combat Application Tourniquet Company. They are the best on the market for you. In EMS, I carry one that's called a Recon. It's very similar to it. It's just a little bit less expensive. Not that these are horribly expensive. You can buy a CAT application tourniquet for about $30. And a lot of times when I do these trainings and I stress to people, it's really a good idea for you to have one. It's a worthwhile investment. Christmas is coming. They make great stocking stuffers. If you're a hunter, an outdoor enthusiast, you hike, or anything else, it's just a really good investment to have. Throw it in your car. God forbid you ever need it, you're going to have it. And you'll be glad that you did. Just be wary if you do happen to go on Amazon tonight, because you're all excited about this presentation. And if you see tourniquets that are 3 for $12.99, I'd stay away from them. You get what you pay for. And if you're trying to save somebody's life with a device, you want to make sure it's good. So combat application tourniquets, again, through our skills session, we're going to work with these in practice. You're going to get very comfortable with using them. So if you ever had to, it's going to be like second nature to you. You'll be able to pick it up. Tourniquets can be placed over clothing. Like you didn't see me, expose my arm all the way up. I was able to put it over my clothes, and that's okay. You just want to make sure that there isn't anything pockets. If you're putting it over a leg, sometimes there's deep pockets in pants. You want to make sure there's no pens, pencils, wallets, phones, anything that's going to get in the way of you actually clamping down on that extremity. If you didn't have a tourniquet available, again, we're going to go to wound packing and pressure like we showed you. There is a product out there called hemostatic dressing that you may find in some first aid kits if you happen to open one up. Quick Claw is one of the trade names for it. And all it is a gauze, like a rolled gauze, like I used in here. This is an old one. And it's impregnated with a chemical that will help speed up the clotting process. If you have it, that's great. Don't be afraid to use it. But if not, remember, any cloth, any clean cloth that you can find to really stuff down onto that wound to the active site of bleeding. And you really want to make sure that you get it down into that site. Just think of if someone is bleeding severely, they're on a blood thinner. It's going to take 6 to 7 minutes for a clot to start to form. If you don't stuff the wound first, pack it, and you just put some material on top and a little bit of pressure, it's still bleeding down into that wound. It's going to keep soaking through everything that you put on there until that clot starts to form. But if you can pack that wound and get that packing material right down onto that active site of bleeding, it creates that dam for that blood to hit against. And as soon as we start slowing down blood, it's going to start clotting. And that's what we need to have happen. Once we put the packing material on, say it bled through on this and I'm adding more and I'm adding more, and you're waiting and waiting, people tend to want to check to see what's going on. It's been like 10 minutes. EMS isn't here yet. I wonder if maybe I don't have to keep holding pressure on it. I'm getting kind of tired. Maybe I can just peek and take a look. And when I do this to teach this to Boy Scouts, they like to do this. They like to go and say, well, I'm just going to look at it. Don't do that if you can. We never take anything off that we've already put on because we want that clot to have started to form. And if we jar this a little bit and pull it a little bit to kind of take a peek and see what's going on, if the bleeding is slowing down, we may actually dislodge those clots and we start that bleeding process all over again. Again, how much blood could that person afford to lose? Did me checking it like that just cause them to bleed more? And now I've sent them into hypovolemic shock because of it. So we don't ever want to kind of peek or take this dressing off once we put it on, but you can always add more and more onto it, okay? So that being said, what if it's a small child? What if it's a baby, 8-month-old, fell, cut themselves? We can do the same skills that you've seen today, and you'll learn in the hands-on class as we do on an adult on a small child. We can pack a wound, especially with a kid. If they have an arterial bleed, a lot of times just by packing it and applying some pressure onto it, we can get it to stop. You know, they're small, they have really small arms and legs. And I had one mom tell me one day, she had a 2-year-old went through a storm glass door, cut her arm pretty severely. And she's like, I just took my hands and I wrapped them around her arm and I squeezed really tight. What she was doing was making a tourniquet for that child by using her hands and stop the bleeding. But we can pack, we can put pressure, we can use tourniquets even on very small children. Right? So don't be afraid to do that. With tourniquet use, some of the misuses with them, sometimes people wait too long to apply a tourniquet if one is available because they're just afraid to use them. Don't be afraid to put a tourniquet on. Again, arm or a leg, tourniquet is available, please apply it. Even if you're, well, I don't know, maybe the bleeding wasn't that severe, just put the tourniquet on, and when EMS get there, they'll assess it and take care of it then. Sometimes people don't put the tourniquets tight enough. They're afraid. If you put a tourniquet on someone properly, it's going to hurt. It causes a lot of pain. You got to think about the amount of pressure that you're putting, you know, on the skin, on the vessels. It's going to hurt. Just because it hurts doesn't mean you've done something wrong. So please don't think that you have. Do not remove the tourniquet once you have applied it on. We never take it off, and don't loosen it up. There are people years ago, it's like, well, you know, their arm, it's turning all kinds of colors. I'll just loosen the tourniquet a little bit, will allow some blood flow down and perfuse that tissue, and then I'll tighten it back up again. But at least this tissue will have gotten oxygenated a little bit. And we can't do that because we're going to be losing more blood. And again, we don't know that number. We don't want to send that person into shock. So once we tighten it, we don't loosen it, we never take it off. But if you notice after a few minutes, if it starts to trickle blood a little bit more, once you've had that tourniquet applied, it's okay to go back in and tighten it up another turn or two if necessary. We just want to make sure that we can stop that blood. Once EMS has come to the scene, you're kind of taking the care of that person over to them. Let them know if you've had a blood exposure onto your hands. Hopefully you had gloves on, and you know that's good, but let them know. If you did get someone's blood on your hands, you're going to wash really good with hot soapy water. You're going to let your primary care provider know that you have had an exposure. When I teach the high school kids, I usually use shaving cream. I put shaving cream on their hands when they put the gloves on, and that simulates the blood for them. And their challenge is to get the gloves off without getting blood all over everybody else or spraying it somewhere. So there is a little bit trick to this if you haven't seen it. If you were lucky enough, you had gloves on when you were treating your friend, take your dominant hand and you're going to pinch in the middle of your palm here and very slowly just wiggle back and forth until you can get this hand clean. Now this should be a clean hand without any blood on it. Take the 2 fingers, slide it up underneath, and then just give this to EMS or paramedics that are there and they'll take care of it for you. Again, wash up really good. Make sure you get under your fingernails, dry your hands up well. And again, let your provider know if you did have an exposure. You can see it's not that hard, right, folks? You identify where the life-threatening bleed is, spurting, pooling, soaking through. Those are the injuries that we need to address immediately. You have a tourniquet available, arm or a leg, don't be afraid to put it on. If not, grab some clean cloth, grab whatever you can, tack it into that wound, all the way down to the bottom, fill it up, put some other material on top, apply pressure to it, and just hold that pressure until EMS comes. Sometimes it's a lot of psychological first aid as well to our people. You're talking to them, you're letting them know, especially with the pain of a tourniquet. Hey, I know this is hurting you, but I'm trying to save your life. Couple last things that I want to show you before we end. We talk about gunshot wounds. Usually there's, you have an entrance hole, of course. Sometimes you'll have an exit hole. These models kind of show that pretty well. The entrance holes are usually a little bit cleaner. Exit holes are a little bit more damage to the extremity. If you can, just look for both. If somebody has an injury like that, they may not have a life-threatening bleed from the one, but they may have it from the other, and we just want to take a look. The same thing with these. We would take some material and just pack it down into that wound. Okay, you kind of look at it first, make sure there's nothing there that's going to hurt you, and you're just going to pack it in and pack it in. Once you get it all filled up, then you put some more padding on top. My fire department guys, they thought I was crazy one night. I came in with a box of tampons for them and I passed them out, and they kind of looked at me going, "Siri, what are you doing?" And I said, "Put it in your first aid kit." Because when you have a gunshot wound like that, it's a perfect kind of fit and does the job for you. Instead of packing, you can just use that. Kind of think outside the box. You're in a school setting. There's, young ladies around. If you need something, ask them. They probably have feminine napkins pretty close by that they could get you something. If you're, there's a mom there with a young child, maybe a bystander, they have a young child right there. They probably have clean diapers in that diaper bag. Ask them for one of the diapers, very absorbent. You can kind of use that for some padding, just, whatever you can to help yourself out. You've packed a wound, you've applied some pressure, and you're kind of waiting. You don't have a tourniquet. EMS, they're on the phone with you, and dispatch is telling you they're going to be 30, 35 minutes out, and we're bleeding, and nothing, even the pressure that you're doing doesn't seem like it's stopping. There is one more thing that you can try. This is outside the National Stop the Bleed program, but as an EMT and your friend, I'm going to share it with you today. This was taught to me by a fellow EMT. You can make a tourniquet if you have a piece of cloth, something that is an inch and a half in width. Neckties are a perfect thing. I see some in our audience today. A lot of gentlemen don't wear neckties anymore. They're in their closets at home. If that's the case, take one out, throw it in your first aid kit. It makes a perfect tourniquet. Winter's coming. A lot of our students wear scarves. A lot of our female teachers wear scarves. These will also make perfect tourniquets for you. They're wide enough. We can't use shoestrings or cords off of hoodie jackets. They're just too narrow. And when you actually start to apply the twist, the pressure to them, it can cut into the skin. So you want to make sure it's something that has some width to it. So you'll just take your material. We'll use this laceration here. We'll pretend these gunshot wounds aren't here on this. We're going to come up just above it like we talked about. And we pull it tight. Makes sense. Pull it tight. This is now our Velcro strap from what a normal commercial tourniquet would be. So now we need a windlass. I need something that I can tie on here to twist. In a school setting, what could you use? A pair of scissors, a strong pen, number 2 Ticonderoga pencil, ruler, dowel, if it's shop class, screwdriver, whatever you can find that you might be able to tie on. I have a pair of scissors right here. We'll just use those. Just be careful with the scissors that you're not cutting yourself or them. So I have what would be my Velcro. I have what would be my windlass. And then just being careful, I'm going to start twisting it. It's harder, yes, but it'll work. It'll slow down that flow of blood. And if you were up here close, you could see where it's really starting to press into the simulated leg. Now, the only difference is I can't let this go like the locking clip on the cat tourniquets. I have to hold on to this or it'll helicopter itself back and loosen up. But in a bind, I can do this and create a tourniquet for them. When we do your skills class, I'm going to have a couple other options for you too that we're going to go over. If the person is wearing, if it's a leg injury and they're wearing a pair of pants, I'm going to show you how you can take that pair of pants, leaving them right on that person and make a tourniquet out of them with just a couple of simple cuts. So you've got skills available to you, even if it's not a commercial kit. You guys know now that you can do this. Identify that bleed, stop the bleed. That's all we're asking you to do. Buy us some time until EMS can get there. 35% of pre-hospital deaths occur because somebody bled to death. We can stop that. We can fix that. So guys, thank you very much for listening. My audience here, so I wasn't talking to the brick wall. I appreciate that. And I look forward to seeing you guys all in your skills class where we get to come out and play with some of the tricks of the trade that I have for you, okay? Thank you.